Any update here, Pete?
Yep, we're about to launch. James, we're live.
Thanks.
Hello, everyone, and thank you for joining Rethink's Q&A session on medical necessity. My name is Chris Macloon. I'm Vice President of Customer Success at Rethink Behavioral Health, and I'm based out of New York City. And I'm joined today by my amazing colleague, Erin Mayberry. Erin is a BCBA with over 10 years experience working with individuals and families on the autism spectrum. And as Rethink's Director of Customer Success, Erin works with providers to implement Rethink's clinical and practice management tools, including Rethink's medical necessity assessment, which will be touched on today. So in terms of the format for today's session, we have 5 topics around medical necessity that will be covered, and then we're going to have an opportunity to open it up for everyone's questions in the audience so that everyone has an opportunity to raise topics as well. Excited to begin. So to get us started, Erin, could you please give us an overview of what the medical necessity assessment tool is?
Yeah, absolutely. So basically, insurance coverage of ABA services is relatively new. Um, because of that, a lot of providers are still not necessarily sure what needs to be documented, what needs to be provided as they are submitting authorizations, and really how to calculate how many hours should be requested for authorization. So what we have done is build an assessment tool that is going to assist a provider in being able to determine, based on the treatment goals that I'm recommending and a lot of other factors, this is the recommended ABA dosage or the hours of service per week that a client should be provided. So just a little bit of a background of kind of how we developed the tool. We first started with some research in the field. So what is medical necessity criteria in ABA? Based on that, we then took a sampling of different treatment plans that Rethink providers submitted to us. And this was over, I believe, 150 different treatment plans that ranged from all ages, early learners to, young adolescents, young adults. From there, we started to develop the questions for the tool with our scientific board, including some BCBAs. And we also then weighted all of those questions. In 2019, we actually piloted this with sample providers that were current Rethink users. And then this has actually been available to all of our Rethink users who use the clinical tools of our platform since then. What we've found to date so far is that there's generally 75% agreement with the clinician recommendation and the tool recommendation. So during that pilot period, we did ask for clinician feedback. And what we found is that if there is a disagreement, typically a clinician is recommending less hours than the tool. A lot of the feedback that we've gotten on the disagreement ranges from, there is care coordination going on with other service providers, maybe schools, things like that. Sometimes there's some limitations to the client's availability and scheduling issues with parents' things. And then obviously last year we saw an uptick in a lot of COVID related issues where services typically may have fell into one range of service hours, but because of closures and things related to COVID, we may be requesting different hours for that reason.
Excellent. So first question for you, Erin. How do I determine what medical necessity is for my client?
Yeah, so, up until this point, it has been somewhat subjective and it relies on the provider, the clinician, to determine that. Like we said, this is relatively new insurance covering all of these ABA services. So a lot of BCBAs, including myself, have not really had formal education around the appropriate way to determine what is clinically and medically necessary for a client. Now that we have this M&A tool, it's going to help you determine all of that based on all of the synthesized research, and then it's going to help you calculate that based on the treatment goals that you are recommending for that client.
Excellent. Next question. What documentation do I need to provide to the insurance company when submitting the treatment plan?
Well, unfortunately, that still kind of depends on the payer. And I know a lot of BCBAs and a lot of providers out there have felt the pain of one insurance company is going to require certain formats for documentation, certain types of documentation, while another one wants something completely different. I can tell you that with the medical necessity assessment tool, you are looking at documentation like demographic information for the client, your skills and behavioral assessments that you've completed, the treatment goals that you will be recommending for this client's services, and then additional learning and environmental considerations, also things like coordination of care. With any of those concurrent reviews, so after you have got that initial authorization and you're doing any reauthorizations, you're also going to look at including things like the client's responsivity to treatment, the clinical outcomes to date, and things like that. So one of the goals of the assessment tool is to start standardizing that documentation. It makes it more apparent to a clinician what they need to be providing to insurance, and it also just kind of helps with that language barrier or that gap in communication right now that some payers and providers are finding that they're having.
So the next question that I'm sure is on everyone's mind is, how do I train my staff in determining appropriate ABA dosage for their clients?
Yeah, so that's actually another goal of the tool, is to really start to train the staff to appropriately recommend based on the treatment goals that they have written and based on the documentation that they have available. Another way that this can kind of work in terms of training is, I know that a lot of parents sometimes have concerns about all of these services that their child's going to be receiving and having people in the home, or making sure that their child is in X, Y, and Z location all throughout the week. So, it's also about kind of getting buy-in for a parent. So it's a great way to train a clinician to talk to parents about the importance of these services, and not only having these services authorized, but really utilizing these services.
And next question, what is the main difference between comprehensive versus focused? Is it just a number of hours or also number of goals?
Yeah, so comprehensive ABA and focused ABA are a little bit different. And one of the things that the tool is going to do based on what your assessor is inputting into the tool is first determine, is comprehensive ABA or focused ABA necessary? Comprehensive is going to really look at a multi-domain approach. So you're considering a lot of different skill acquisition programming, behavior reduction goals, and thinking ahead toward kind of transition planning toward that more focused approach. So you are typically looking at a larger number of goals, and typically more within that range of 25 to 40 hours a week of services for the client. With focused ABA, it's going to be more of a limited domain approach. So you may be just focusing on things like behavior reduction goals, or you may just focus on things like social interaction goals. This can even take more of a consultative or parent training approach. So you're definitely looking at fewer hours, and less domains are being covered with focused ABA. Once the tool has determined whether or not focused or comprehensive ABA is appropriate, and it may even determine that you're not meeting medical necessity criteria, so you actually don't need any of these services, but it will then take that and really calculate the number of hours that should be spent toward targeting each of those domains. So for example, I may focus, 8 of my 40 hours a week on social interaction goals, whereas I may be only focusing more on behavior goals for 4 to 6 hours per week.
Excellent. Now, I've got one more question before we open it up to audience participation. So for those of you listening today, please start typing in your questions. So the final question I've got is, what if the parents only want 10 to 15 hours per week, but my clinical recommendation is 30? Do I ask for what is clinically appropriate or what the parent can commit to?
Great question, and it's one that we hear a lot. I clinically think that this number is appropriate, but I know that in actuality, we are not going to be able to commit to that number of hours for whatever reason. As a clinician, it is your responsibility to advocate for the client. So what is clinically necessary? If you go that route and you ask for more hours, more toward that 30 hours, low utilization of the authorized hours can be a problem. And we know that pain point with insurance. If you are demonstrating that you're not using the hours that are authorized, you tend to lose those hours. That being said, again, it is your responsibility as a clinician to determine what's clinically appropriate, what's supported by the research that we do have out there. So one approach you might take is you're going to request the hours based on the client's actual availability, maybe 10 to 15 hours per week, but make sure that you're documenting. I would normally recommend this higher range of hours based on what I think is clinically appropriate.
Excellent. Thank you, Erin. So now we're going to move to some questions from the audience. So the first one looks like it has to do with the medical necessity assessment tool itself. And at what point during the process is that typically used? Is it at the end of the report writing, before the report writing, and the best practices or tips there?
Yeah, so best practice, you want to make sure that you have all of your documentation already. So definitely make sure that you've completed any of the assessments that you are going to do during this process. And, I would make sure that you've received any documentation from other providers or other professionals you're working with before you start to use the tool, because the tool is going to go through a section on different planning considerations. You're going to have to document the number of treatment goals you're recommending, the domains that you are expecting to focus on, and it is going to have documentation on what types of assessments you've completed. So all of that I would recommend doing prior to actually completing the tool.
Excellent. And the next question, which you may have touched on, is are providers typically actually submitting the M&A resulting document with the treatment plan when they're submitting to insurance, or more keeping that for internal purposes?
Both. We do actually have a lot of providers who are submitting documentation with their full documentation they're submitting to a payer. So when you complete the medical necessity assessment in Rethink, you'll have two options for a report. The first is just a summary that is going to give the overall recommended number of hours per week, and then that breakdown and how it's being allocated to different domains. And then we have a detailed report, which actually line by line goes through every assessment question and response from the clinician. So you do have PDF copies of both of those. I typically have heard that providers are just submitting that summary along with their requested hours as kind of validation for, this is how I came up with this number of hours I'm requesting. And you may be using that detailed report more so to share with any other staff, any other team members for that client's case, or even in kind of talking to a parent about why it's so important that we are able to then utilize any hours that get authorized.
Amazing. Well, it doesn't look like we have any other questions. So Erin, I want to thank you so much for the presentation today. Again, if there's no more questions, I want to thank everyone for participating. As a follow-up, you will be receiving a link to an article that Rethink put together on M&A. Please continue to follow us on Facebook or LinkedIn for updates on future such events. And feel free to contact Aaron or myself if you have questions. And if you don't have our contact information, feel free to visit our website, rethinkbehavioralhealth.com, and you can fill out the contact us form, and you can include M&A in the subject line, and then we'll get you more information about that. All right, everyone. Thank you so much for participating today, and have a great rest of your day.
Thanks, Chris.
Thank you, Aaron.